Hi, everyone. And hello, Antonio, doctor. We are very happy to be here. And I will say we will start a fireside, and we will like to involve all the audience in our conversation. And we are going to have a nice conversation because we already started, no, a little bit before, talking about several things. But I will ask you, first of all, why we talk about the hospitals of the future? Why the future here? Is the present, is the future, how we can imagine this distance on the time and how we manage the time here?
Okay, thank you. I think I have to say thank you very much for the organization, because talking about the hospital of the future, I think is the first mistake, because it's not hospital of the future. One of the most important things when we discuss with the people, with many people around the world, different disciplines, is we have everything to build the new system. I don't want to talk about hospitals, because it's more than a hospital. It's a healthcare system, and we need to change. I remember, a video probably you saw from a professor of Kaplan University saying, "I apologize because I'm failed." And that's true, because we are making big mistakes in the, not saying the hospitals. There is a reason, because probably starting with hospital of the future is good, because we'll be in the next future. But everything we wanted to include in this new system we have today.
Exactly.
We don't need to wait new things.
Exactly. I think here's the point, no? Is we are here with this new frontier of technologies, no, and embracing the digital space, but how we can, no, and this is a cultural approach, no? When we say something is not working in different cultures, we are accepting or not that it's not working, no? But to make it better, we need to accept that it's not working. So you say, no, we need to accept that something is failing us, and we are accepting to change it. So how we are changing, no? What is a little bit your approach on this new change of what we are doing right now?
Okay, I think it's so simple, because I'm not like you. All of you are incredible persons. I'm just a surgeon. I'm just, using my experience during the last, let me say, 45 years. I'm quite old.
Saving lots of lives,
Well,
I think.
It's my job. However, I know every day I realize what will be the mistakes. One mistake is how we talk with the patients. For example, now we have in Spain, we have an incredible health system. It's a universal health system. It's very good. However, it sometimes could be easier if you decided to say goodbye to the life. That means instead of discuss with your doctor, looking to the eyes of the doctor, not the doctor looking the computer.
Completely agree.
What will be the future in the treatment? Yeah, they are discussing about new chemo, for example, in cancer patients. And that's I disagree. And our big phrases is nothing about me without me. And that is very important.
I think what you are saying is, I really enjoy what you are saying in terms of engineer, no? Like in digital technologies, we are looking for the tool we are building is useful. But always I said, if the tool is useful, we should not talk about the tool. We should talk about what is the purpose on the usage. So sometimes when we talk about digitalization, I'm scared because I say, no, it's about people. It's about allowing telecommunication, allowing communication in a remote way, no? But to do communication, this eyes to eyes, this human communication about something that is really important for us, that is our decisions on life or death, we need to train doctors. We are so used to computers like a means to in my case, no, a means to put a barrier and not to face the real conversations? You feel that the doctors are not facing the real conversations and they are using the digital technology just to be behind the reality? Could be that? Could you say, let's send this email, let's send this communication, let's send that to the nurses?
I think it's a very good comment. Because there is a reason because I created the AIS. It's because AIS is a platform dedicated to education. When we started, we have 460 people involved. Now we have more than 1.5 million. 1.5 million in your world is nothing. In my world, in surgery, is a lot. It's the first platform in the world in education. At the same time, you can use digital system for many things. For example, we created a system because it's a 3D, based in virtual reality, etc. And you give to the patients because, okay, I can explain to you, you need a surgery. And the surgery will be this. And the surgery can have these complications. Normally, you have to sign an agreement. Normally, the patient doesn't understand the majority of words. And at the end, when they arrive the day the surgery, go to the hospital, they don't know anything about that. They enter in a very hostile, it's a very different situation. He's very nervous and arrive to the hospital and we send to the operating theater. The operating theater is like this now. It's everything with screens, cameras, etc. Enter. And the most important thing, when they finish the operating theater, they go to the recovery room with many people. They say, come on, I'm in the earth or I'm in the heaven. The operation was good or not. And that's we try to explain to all of them. That is the reason because digital system is so important for our patients.
I completely agree. And in fact, what you are saying is something very important. That is the empathy, no? So maybe the hospitals of the future are the hospitals with empathy, no? With the communication between, all these processes, as you are explaining, maybe we can understand as a patient much more clearly, no? And we can empathize with the situation that, yes, we need to pass through the surgery theater, we need to do, maybe, is this, no? We are missing some communication there, or?
Maybe we can do a game. You are the moderator and you have to do it, if you agree. It's asked to 5 people here.
Yeah.
When you build a hospital, it's created for whom?
I love that. Let's go for it.
For whom? It's for whom?
Let's go. Please, audience, collaborate with us here in the Fire chat and tell us, for whom is created a hospital? For whom? Who is the one, who is the brave answering us? Anyone?
This beautiful lady with the green hair. Okay, ask the question.
Yourself. For whom do you think is created a hospital? For all of us.
Do you think it's for all of us? Or is created for doctors?
Doctors here. Doctors.
It's one thing. Sorry?
Who else?
Administrators. Nobody is saying, okay, I think it's enough. Nobody is saying the truth. The truth is the most important in a hospital is not the doctors and administrators, it's the patient. And the second one, who? The doctors or the administrators? No, the family of the patients. And that is the reason because we created the concept of hospital we deserve. But not we deserve for doctors, administrators, let me say politicians. No, it's for patients. That is the most important thing.
That's the most important thing on these hospitals currently, no? And digitally speaking, how we are embracing them, how the patient is the center.
Very easy. I cannot say many things because I signed so many NDAs in the world. However, it's very simple. Now, in our health system, very good health system, you have one app. In Catalan, it's La Meva Salut, it's my health. And you enter in the health, and you have the diagnosis. You have the diagnosis of because you have a colonoscopy 1 day or 2 days ago, or maybe more, maybe 10 days ago, because you are, bleeding in your stools, and put adenocarcinoma. You can imagine, you have this. And after that, you receive, because you have to go to the hospital to see a doctor, 10 days later. That means when you started with the first symptoms, it's 20 days. After that, you go to the doctors, let me say, sorry if there are many here, I'm a doctor too, saying, what is your problem? Say, come on, I have in my app and carcinoma. Try to skip for the time this patient, say, okay, you need a CT scan, you need a blood analysis, you need a PET scan, you need many things. After that, maybe you need to have radiochemotherapy, or and you don't know anything. And that is not good, because you have to go to see the radiotherapeutics, the radiologist, the lab, etc. That is not good. That is not fair. Imagine, when you have a family, in my family, unfortunately have horrible experience in my family, you take your hands of the patient and you go. That is the way we wanted to do in this new hospital. When you arrive, everything is ready. And everything is not based in human, because we committed so many human errors. Everything is based in artificial intelligence. You can create what you want.
This is something that is really important, that we in technology, we say code is low, no? It's like we believe that what we are coding is good enough or better than us, no? And that's something that we are sometimes scared about that, because you are delegating to the code several responsibility on decision making. But what you are telling us is trust the code, because what we doctors, we need to do is help you, and when you arrive to the hospital, whatever we have mechanized, whatever we have automatized with the code, is whatever is necessary in terms of protocol and processes.
Yeah.
I understood it properly, no?
Absolutely. Could you imagine if I'm a surgeon operating a patient, and you need to know if you are cutting in the right way, because maybe it's involved with the cancer, and you send a pathology during the surgery. And the pathology, maybe it takes 1 hour and a half. With the new system, you send the pathology, in 30 seconds you have the result. What is better? To have 300,000 similar patients in your computer, or to have, let me say, a pathologist who fight this morning with his wife?
Completely agree. The second one.
I think, yeah.
Completely. There is a very important thing here, because I fight against, during pandemic and before, to make understand that data is something that we need to protect, but it's not the data what we protect. What we protect is our identity or privacy. So this, how we can help us all together, all the audience here again, to make understanding that technology is just a tool. What we need is us decide what is our decision-making process on terms of privacy, and when we are in terms of life or death, what we are needed is systems and doctors that understand ourselves, no? So this risk about my privacy and my data and my systems, how we can escape of these discussions, no? And talk more about if the system has a quality, if this is something that we have tested, verified by the engineers, then it's working, no? So I don't know how we can explain everybody that what is important here is the patient and the relation with the doctors and save the life, no?
The patients and, let me say, again, family.
And families.
Yeah, it's very important. And you mentioned pandemic situation. Pandemic situation, we learn a lot, but we're not using enough.
Exactly.
And for example, people are so impressed about in some cities created a new a hospital, that means new beds, 1,000 in 10 days. That is good or bad, because if you have your hospital here and normally the hospital you work is 10 kilometers from this new hospital, you have to move all the healthcare professionals to the hospital. That is the reason, because I think it was absolutely a disaster during the pandemic situation. You know, we stopped around the world probably 80-90% of the surgery. In my experience, we operate patients with incredible tumors because was my misdiagnosis, or too late a diagnosis, like 30 years ago, and that was a disaster. The hospital of the future creates what you want, because you can take what you want. It's not necessary to have a room. Sometimes a room is a room with beds, sometimes it's an operating theater, sometimes in an intensive care unit system.
Adapting them, adapting the place, the space, to really do what is needed at this moment. No, time is life. No, it's something that we always. We are having some time down, but I was really interested to know a little bit more in a positive sense. You have talking before. You had said that you are training doctors, and we as engineers, we will love to have this med tech or tech mech. What about this? What about the dialogue, the wording, how we can join forces between the digital engineers and also computer science with all the professionals on the healthcare system?
You are very good, because you are making a very good question. The main problem is surgeons are working between surgeons. There is a mistake. Now we are creating the concept of collaboration with other disciplines. For me, the most important is engineers, bioengineers, many people, and people from the basics. We don't have enough time, probably, but I can make an example. Many people love the robotic surgery. It's not true. It's not any of the robotics is a real robot. It's just a manipulator. Now we are working in a system that is in the future, but the future means probably 2-3 years. Immediately when you are sitting into the console of the robot realizes if you are expert or beginner, and start a dialogue between the robot and you, thanks to the engineers.
Yes, I will. We need to close here, but I will close with a huge amount of hope, because what you have said is really what we try to design in the systems, that is the personalization in a terms of we should know the paradigm of technology is that nobody noticed that there is technology, but it's really usage for what is needed. So in this hospital of the future, in 2-3 years, probably we will have our families with us, we will have a clear dialogue with our doctor, and we will spend very few time in the hospitals. And I hope and I wish that this is coming very soon, thanks to you. And I will really tell everybody that it was an honor for me to interview you and to have this Fireside.
Thank you very much. I think with the innovation, we can treat better our patients.
Thank you, and
Thank you.
We are run out of the time.
Thank you.
Thank you.